Hi, my name is McDonald, and today I'll be going over patient education for acute bronchitis, persistent cough, and nasal congestion. So, acute bronchitis, what is it? It is a viral infection that is contagious and causes inflammation of the bronchial tubes in your throat. Some of the symptoms associated with this are chest congestion or tightness, sore throat, fever, body aches, things of that nature. So for the treatment of this, fluid intake is highly recommended. Rest, a humidifier if you have one, and then a couple medications that you can use to also help take away some of the pain that might be associated with some of the symptoms are acetaminophen or Tylenol, and then ibuprofen. So for acetaminophen or Tylenol, the adult dosing is 325 to 1,000 milligrams every 4 to 6 hours. And then for the pediatric or dosing for kids is 10 to 15 milligrams every 6 to 8 hours. Some cautions for this medication are hypersensitivity to this drug class, any liver or kidney impairment, PKU or chronic alcohol use, and there is no harm taking this if you are pregnant. For ibuprofen, the adult dosing is 400 milligrams or 2 of the 200 milligram tablets. For the children's dosing, it's 5 to 10 milligrams per kilogram per dose every 6 to 8 hours. Some cautions are mainly the GI bleeding because it is known to cause some stomach discomfort, and do not take it if you have any cardiovascular disease. And then you should avoid taking this after your first trimester. So for persistent cough, it is basically an expulsion of mucus, microbes, and foreign particles from the respiratory tract. Some common causes of a cough are a postnasal drip, asthma, GERD, and chronic bronchitis. Couple of medications you can use to help treat this are any antihistamine, corticosteroids, decongestants, cough suppressants, antibiotics, just depending on the severity of the cough. So Robitussin is one of the drugs that you can take in order to help get rid of your cough. So the adult dosing for the Robitussin is 10 milliliters every 12 hours. For kids, it's 5 milliliters every 12 hours. A couple cautions is to not give this to anybody who is less than 6 years old or hypersensitive to this drug class. And there's no known harm to take this when you're pregnant. Another one is just a basic antihistamine. For this one, I chose Zyrtec Allergy. For the adult dosing on this, it's 5 to 10 milligrams every day, and that goes for anybody who's 6 and older. Some cautions for this are the hypersensitivity, the liver or kidney impairment, or alcohol use, and there is no known risk associated with Zyrtec on pregnancy. So the last condition is nasal congestion. It's when your nose becomes stuffed up or inflamed. Some causes of this, it can range from a cold to deviated septum to the flu and things of that nature. So for nasal congestion, a couple medications you can take are antihistamines. There are nasal sprays. There are antibiotics, depending on if it's a bacterial infection or any over-the-counter decongestant. So I chose to do a nasal spray for this one. So basically, anybody 6 and older, it's 2 to 3 squirts per nostril every 10 to 12 hours. Some cautions for this are, again, hypersensitive to the drug class, diabetes mellitus, and any cardiovascular disease. And there's no known risk for any pregnancies. And then the last drug I have is Sudafed, which is basically a decongestant. For the adult dosing, it's 2 tabs every 4 to 6 hours. And then for the kids dosing, it is 1 tab every 4 to 6 hours. So basically cutting the adult dose in half. The cautions for this are pregnancy in the first trimester, any cardiac arrhythmias, cardiovascular disease, or diabetes mellitus. And then if you are pregnant, avoid use in the first trimester, and then use it sparingly if you have to during the second and third trimesters. Here are my references.